We are back here on Girl Talk. Dr. Audrey Klenke has joined us, and we're talking today, since it's summer, about skin cancer. And you are a plastic surgeon, and Deb, you were asking her about being the only woman.
Well, you're the only female plastic surgeon in Beaufort County.
In Beaufort
correct?
County, that's right.
That's very awesome. And the other thing was, in terms of skin cancer and some of the things we were talking about before we started rolling, I didn't realize that I can kind of just go directly to you to have some dermatology things addressed versus kind of doing things in steps. So if a procedure needed to be done, you can handle it.
And I have to say, Jen, the other day I went in to see Dr. Klenke, and I was just sort of investigating. Okay, I'm 60 years old. Take a look. You know, are there?
You're 60?
Oh. There are
60's
the new 50. Yeah, I'm almost 61. But my point is, I was like, okay, what can I do to look the best? You know, what are some priorities? How do you prioritize? And I'm thinking, oh, Botox will be really cool, right? Tell me about a facelift. And she's like, well, why don't we address some things that look like potential skin cancers from 60 years of baking in the sun? And I was like, okay.
Dun, dun, dun.
Yeah, dun, dun, dun. And maybe now that you're older, your eyelashes have gotten tiny, tiny, tiny. Maybe you should look at something like a Latisse. And then the third thing, and I'm just being really open, is she said, and you know, as I look at your ears where you've had pierced ears for a long time, they've pulled, and it makes you look older. So go ahead and take it from there, but just talking about assessments and evaluations.
Absolutely. So I guess the way, and to address your question about dermatology, there is so much crossover between dermatologists, ear, nose, and throat doctors, orthopedic doctors, so I do hand surgery, so there's always a lot of sort of overlap, and I think people get confused. Breast surgery. So people kind of get confused about, well, when do I come see you? And to clarify the skin issue, I will see any skin lesions. I'm happy to do biopsies, and I'm happy to step in when there's a hole that's a pretty good size that needs to be fixed, and you want it to look as good as it can possibly look. But I do full body skin checks and the whole 9 yards. So yeah, there's a lot of overlap.
One of the things for me that I found so inviting and what helped me is I felt like you were very user-friendly. You were very, you wanted me to, she made sure I understood before any procedure was done, number one. And also, it's on your face. When it's on your face, I don't care if you're 20 or 40.
You wouldn't let anyone but a plastic surgeon touch your face.
Do you agree with that too?
Absolutely, because the skin's delicate, it can scar more. I mean, you know, so you may be diagnosed by a dermatologist, but if you're having something significant removed, you know, you'd be crazy to put it in anybody else's hands, I think.
I mean,
me too.
And skin cancer is something that we have to be aware of, especially down here.
Skin cancer is very scary. Yep, down here, and people think, oh, well, you know, I'm 30, I'm 40, I'm in my early 50s, but really it can affect anyone. And some of the more common skin cancers, basal cells, squamous cells, you know, they can be scary, but they're usually curable if you catch them early enough. Melanomas, you know, even those that are very scary, still, if you catch them early enough, they're usually curable. But there are also precancerous lesions, and sometimes those can progress to a skin cancer. So if you catch them early and you can prevent them from moving on, you can save yourself from that extra scar and the extra worry.
So are there topicals?
There are topicals. There are awesome topicals now. There are a few different ones on the market. One of them is newer. It's called Picato, and you only have to use it for 2 days on your face. If it's an arm, it's 3 days, but compared to weeks or months from the previous topicals, much better.
Can I shift subjects for a minute and just ask about what are some trends in plastic surgery from your practice? What are you seeing? What is fun? What is new? What works? What do you recommend?
What's most in demand?
I know. Yeah, what's most in demand?
I would say the biggest trend over the past 5 to 10 years has been fillers and injectables, things that are a little less invasive that you can do in the office. Fillers have taken a huge turn because now all of the companies are competing with each other, and so you have this huge variety of safe, very effective products that you can use in the office. So you kind of get to pick and choose the right product for the right person and the right place on your face.
They don't have to be as invasive as doing the full
face.
Now, what I do in
Joan
the mirror.
River.
Or First Wives Club.
It's called the facelift move. You know, when people come in and say, and sometimes, you know, that you need something surgical, but a lot of people these days are really finding that they can stave off some of the more aggressive things by trying things that are less invasive for.
Well, and we were talking earlier about preventative. You know, so if you get out ahead, if you get Botox when you're younger, you get out ahead of the deep creases and lines that you might have to have a lift or something surgical later. So
You've got it.
But you do also do things like facelifts and all that. And it is pretty funny. I walked in, I went, I kind of want to look like, don't do that, that's the facelift.
So there's a name for that motion. Yeah, we do all sorts of things. Facelifts, I do a lot of eyes and eye rejuvenation, brow lifts. A lot of people don't like their neck, even men. So yeah, there's a lot of fun
Yeah, you got a
things.
lot of guys
A
too.
lot of
don't you?
guys. Guys are on the rise.
Well, I appreciate you joining us. Stay with us, there's a lot more to come here on Girl Talk.